Hello. Well, the reason I'm holding this goofy thing is I've got some important things to talk about. So if you couldn't tell where I'm at today, I wanted to show you. I'm here in the Uintas, and right here on the banks of the Bear River, in this beautiful place. I've been doing a little fishing, haven't really caught anything, but it is about 12 o'clock in the afternoon, and it's May, so it's not the best time of year to be fishing, but we'll give it another shot here in a little bit and see if we can't catch anything. But I'm just kind of hanging out and relaxing, and that I wanted to talk about CPR. There's some really important things about CPR that I want to make sure that we discuss. And the challenge with CPR is a couple things. Number one, our challenges are it's something we don't do very often. In fact, for most people, at least lay responders, they've never done it. And they may have got training 2 years ago, 5 years ago, 10 years ago, or heard about it. And even worse is the only thing they know about CPR is what they've seen on TV. So my first statement, I guess you could say, first trouble to overcome is, yes, it's scary, yes, it's new, yes, it's something you haven't heard about, but it's not a difficult skill. So, most importantly, please go out and get certified to do CPR, at least once. And then from, every few years, just check in with the American Heart Association or Red Cross and check on the standards to make sure they haven't changed. There's constant research going on to improve and to change the way we save lives based upon scientific research. And that's a tough thing to do. You can't give people heart attacks and ethically and try CPR and see if you can bring them back to life. So this has to be done by way of testing things in hospitals to see if you have a greater success rate of CPR using different tools or different methodologies. Incidentally, I do give free classes in CPR, so if you would like to take advantage of that and you're in my area, which is by Wyoming, I do free classes to anyone willing to listen to me yabber on for a while. But I wanted to cover for you just to kind of debunk any possible misconceptions of what is right and what is wrong when it comes to CPR. Remember that under the laws of the Good Samaritan laws, and I'm no lawyer, but Good Samaritan laws basically say that if you help someone to the best of your ability, you cannot be held legally liable. So, you have someone who's not breathing and you start CPR and you cut their shirt off and that person lives and they're really mad that you cut their shirt off, tough. There's not a court at least in the U.S., I'm not sure about the rest of the world, that would back up a legal suit for you to do exactly what you're trained to do in a CPR class. So the only time you can get yourself into trouble is if you go beyond what you have been trained to do. You obviously can't, do a cricotomy, which is where they stick the hole in their throat, or you don't want to do surgery on somebody, or try to give them stitches. Those are all well beyond basic first aid and CPR training. That's when you can get into trouble. But as long as you're following the procedures and the practices that you learn in a CPR class, you can't get in trouble for that, as long as you do what you're told. So, the second thing I want to talk about is calling for help immediately. If you have the gut feeling or something you're looking at that just needs some help, get that help as soon as possible. So, let's talk about that. If you see someone go down and they're not breathing, and you've decided it's time to start CPR, there is a rule. The rule is if you saw them go down, go get help immediately and then come back and start CPR if you can't call them immediately from the scene. If you did not see them go down, in other words, if you found someone who was already down and you didn't see them go down, start CPR, do 2 minutes of CPR. That's going to be 5 cycles of 30 compressions, and then go get help. So 2 minutes of CPR if you did not see them go down. So just remember that little rule. Now, important tools we're going to need for this. You're going to need, if you can, get an AED. If not, so be it. If you, most importantly, get a barrier device. A barrier device is something that protects your mouth from their mouth. Okay, so you know, we're going to try to be doing breaths for this patient, for this person. You want to be protected from them and them from you, from any kind of saliva, any vomit, blood, etc., any kind of liquids passing between you and that patient, as well as bacteria and things. So we want to be protected as a rescuer. You want to be protected. Do not do mouth to mouth. It's just my personal opinion, but that's something that it really isn't that necessary, and it puts you at a greater risk as a rescuer to do mouth to mouth to someone that you don't know, or even if you do know them, to possibly get some type of bloodborne pathogen from that patient. So the other reason we don't do that is because really you're moving air in and out by doing compressions, so we don't have to worry about it. So if you don't have a barrier device, then just continue with compressions. Don't worry about breathing for that patient. If you have a patient that you're going to be working on, just remember that they need to be in an area where you can work on them. So they need to have an area around the patient that is free of stuff. So if they fell underneath something, pull them out from underneath it. If they're in bed, you cannot do CPR in a bed. Pull them out onto the floor and drag them onto the floor and do CPR on the floor. Do not do CPR in a bed. Do not do CPR in the water. It's impossible to do good CPR if someone's laying in the water. So drag them out of the water, drag them out of wherever they're at, and get them on some type of semi-flat ground, if at all possible. This dirt ground here is perfect for working on a patient, and that. But if they were falling among those rocks, you know, this kind of thing, these rocks and things, I would have to move them. So then once we've moved the patient to where we can work on them, and we've called for help, and hopefully got an AED or a first aid kit of some kind, we're going to try to protect ourselves with gloves if we have surgical gloves. If we don't, then so be it. But we try to, and then if we don't have a barrier device, we're not going to do breaths. So then we're going to start compressions. Now all this happens extremely fast. I've been talking for probably 5 minutes on this, but this all happens within a matter of seconds. Do you have a barrier device? Yes or no? Do they need CPR? Yes or no? And then start compressions after you've called for help. It's that simple. And then we're going to start compressions. It's going to be 30 compressions as fast and hard as you can. Our goal is to get between 100 and 120. 120 is really what we want, but a lot of people can't press, you know, twice a second on a patient. So it's important that you just do as fast and hard as you can, usually on an adult. On kids, it's going to be 1/3 of the chest, and it's going to be 15 compressions rather than 30. Okay, and this is going to be on kids. So we're going to do 15 and 2 breaths, or 30 and 2 breaths if it's an adult. And that would be probably from age 12 and up, maybe 14 and up, depending on the size of the kid. You're looking for about 4.5 to 5 feet tall for that determination of how to change that. Of course, you're going to call 911, and 911 is great. Most 911 dispatchers around the world will help you, and they'll tell you what to do to remind you. So that's a great resource for you. And of course, you want emergency services on their way as fast as possible, because time is life when we're talking about cardiac arrest. So if I'm going to do compressions on a patient, I'm going to get in the customary position. You want to be on your knees. You can't really do it bending over the patient in another way. You need to be on your knees on the ground. You need to have, you know, your strong hand on the patient in the center of the chest. There's a little depression right here between the breasts on women or men, however you want to put it, but there's a depression right here. You don't want to get to the soft spot. You don't want to be too high. You want to be right in the center of the chest, and you want to have your strong arm down first, your less strong hand down, and that one up on top of that hand, and interlace your fingers if you can. Again, you're going to do the best you can. So, you know, you do what you can, and you're going to push in this. Now, the motion for this is to bring up your shoulders and use your body to press. We don't want to do this. And so you're going to use your body to compress, and you want to compress 2 inches, and then make sure you let off and let the chest come all the way up. And then you're going to do that as fast and as hard as you can. So you're going to count as you do this. You're going to do 1, 2, 3, 4, 5. Okay? And if you can do 100 to 120 a minute, that's great. So you can use the Bee Gees song, Staying Alive, or if you're a little more morbid like I am, you can use another one, Bites the Dust, from Queen. And so, you know, you can get in there and you can compress that way. And you're going to compress 2 inches, and we want to move our body, not our arms. Okay? We don't want this. We don't want to use our wrists. We don't want to use our elbows. You want straight arms and use your whole body. Use your body strength and your back and your leg muscles to do these compressions, because you're going to need the strength, especially if you're working on a larger patient. And then if you have things like injuries or something that you're working with, you can try doing this kind of thing. But one-handed CPR is not usually efficient. Do what you can. If you have a broken arm or something like that, I suppose you do what you can, but at the end of the day, you want to use the most efficient process, and that's because CPR is a very physical exercise. Every time I've done CPR, I've been very sore for several days because it's very physically demanding. So we're going to do that, and we're going to count to 30. So 30, we're going to compress for 30 times. And once we've got to 30, we're going to take 2 breaths. Those breaths are 5 seconds apart. So we breathe, and we breathe for that patient just till we see the chest start to rise, and you stop. You don't need to overinflate them, so don't inflate them a ton. You don't need to. It's just a breath, and you just watch for the chest to come up. As soon as you see it move up just a little bit, go ahead and that's a good enough breath, and then let them relax, and then do it again. And then after 5 seconds, make sure you count to 5 between those breaths, and then it's time to start CPR again. Okay? You should never take more than 10 seconds away from doing compressions to do breaths. And that. Now, we continue to do that as long as either 911 tells us that the EMS is there, and they'll tell us when we can stop, the EMS personnel. Most of the time when any kind of emergency services arrive on scene, they won't just take over. They'll have you continue so they can get things set up. They're going to place AEDs or an EKG or ECG monitor on this patient and check out their heart, get ready to shock the patient, put an AED on there possibly. They might be applying some type of an airway device. There's several different airway devices we can use for different skill levels. And so they may need you to continue doing CPR while they get those things set up. Then, when they tell you back up, it's okay. The other reason you would stop CPR, well, there's 2 more reasons. One reason would be if they sit up and say, stop pounding on my chest, or they start spluttering and coughing on you. If they're doing that, they're breathing, and their heart's beating. So you can stop CPR if the patient either regains consciousness or appears to be taking care of things themselves. And then the other reason would be is you just are too exhausted. There's nothing wrong with giving it everything you have and then giving up. And you just do as best you can for as long as you can. But if you're all by yourself and you just can't go on anymore, that's what it's got to be. So we don't want to put ourselves at risk by hurting ourselves by doing that. So just make sure you continue with that CPR as long and for as consistently as possible, and do those compressions, and then help as best you can when EMS gets there. And it may be when EMS gets there, they have you just get right out of the way, or when the police get there, they might have you get right out of the way. Just kind of pay attention to what's going on there, and offer help, but make sure you're not in the way. So that's CPR. And so I hope that's as helpful. AEDs are a great tool, and they're very commonly available. Almost every school and cop and a lot of truck drivers and construction companies and everything carry those. So if you have the option of using an AED, terrific. All you got to do is, I'm not going to go terrifically into AEDs, is all you got to worry about is turn the thing on. It'll tell you what to do. You do have to cut all the clothes, all the shirt, bras, undershirts, whatever it might be. Those need to be removed to place AEDs. An AED pad should go here and here, above the right breast and on the left side. If it's on a kid, you're going to do one on the front, one on the back. The point is the heart is here. We want to shock through the heart. So if we have to do it one's front and back, that's fine. If someone has an internal defibrillator, so they'll have like a big thing mounted right up underneath their underneath their chest here, underneath the skin. You just place it somewhere around there. You don't put it right over the top of it. But you certainly can shock someone who has a pacemaker or an internal defibrillator. So I hope this is helpful. CPR is something we never want to do. But when you do everything you can to save a life, regardless of whether you're successful, there's a tremendous amount of emotions that go with that. But one of them is knowing that you've done everything you can do. So just remember, never pay attention to CPR in the movies or on TV shows, because they never do it right. It's 30 and 2. Call for help as soon as possible. And good CPR can be the difference between life and death for someone out there. Well, I'm the AVD medic, and I'm going to go back and go fishing. I'll see you on the trails.